Live from the Channel 11 studios, it's Great Day Houston.
It's no knife, but it is a needle. So stick with us because Dr. Leconey is going to be here. He's going to show us how to look younger out of a bottle. We'll be right back. Show. If you're like me out there, you may be frightened about getting surgery. You know, cutting into your skin seems like the last thing that you want to do, especially when it comes to looking younger. So here to talk about a non-surgical solution to the fountain of youth is Dr. Richard Leconey and his wife, Dana Leconey, and then also their patient, Beth. So, first of all, I want to get in to Beth. Beth, you told me that your daughter actually suggested after you ran a marathon that you do this. It's almost kind of counterintuitive.
Well, it really starts with, my own philosophy is it has to start with inner. And I like your show because it's really describing the full spectrum of taking care of yourself and being your best self. And in my business, I'm a career counselor and college counselor. And so I believe that people should do what they love and love what they do. And also take care of their spiritual side as well. And then eat right. And then, what the Leconeys did for me, which was help my appearance. And the marathon was part of my take care of myself and be fit. But then my daughter said, Mom, you have this massive wrinkle. It's like the Grand Canyon between your eyes. And
Don't you love daughters? Don't you love them? She's a teenager.
She said it in love. She's 20 years old and she's beautiful.
There you go.
But I did have a huge wrinkle in it. And I just never, I take care of other people a lot. And I didn't really take care of myself, and it was her encouraging words to say, Mom, reward yourself after the marathon with Botox or with a liquid facelift.
Which is so cool. So her 50th birthday comes along, Dr. Leconey, and she comes in rewarding herself after her daughter points out her Grand Canyon in her forehead, as she said it. So what did you do? Because she looks stunning. She really does.
Well, you know, the best part is we didn't have to do that much. You know, Beth already has great facial structure, everything you need. There was a little bit of fine lines, a little bit of early sag of the skin, like people will get at a certain time in their life, a little bit of loss of the plumpness of the skin volume. So that's what the liquid lift is all about.
So we have a before and after I want to see, just so that you all can see it. Wow. It really does. You said that you just have to have, you need to plump up your skin. So let's talk first about the eyebrows and the crease right there. You said that it's a mixture of Restylane and or juvaderm and Botox.
Juvaderm, Restylane, which are both fillers, and Botox, which is a relaxant. Okay, you want to relax the muscles that create wrinkles.
Okay,
and then strategically employed, you can also relax muscles and achieve an elevation of the brow just a little bit, as if you'd had a brow lift.
Right.
Maybe not quite as dramatic as a brow lift. That's what this is all about. You know, the liquid lift is using something that's liquid and injectable through a fine gauge needle, as opposed to a knife or other more radical surgery.
The recovery time. I want to talk a little bit about Dana, because Dana has the most beautiful cheekbones, which you also helped out with Beth. So what do you do for cheekbones then?
Basically, you just inject a filler right along the bone, and that plumps, gives the volume back. In fact, on Beth, she was starting to see some, you know, kind of shadows under her eyes, so we also plumped her up as well in that area. That's the tear trough.
And then what Dr. Leconey explained to me, Beth, is that once they put it there, it also pulls from the laugh lines, leaving, you know, less in the laugh lines. And then do you also inject the laugh lines?
Absolutely. You know, but on the cheek, it lifts the chin a little
bit. We also gave her a little bit of a brow lift and eyebrow arch by just injecting Botox.
So, I mean, wow. And all of that, what about the pain? Was it painful?
Not at all. I went back to work the next day. So
you did?
I had a little bit of swelling, and I think that's expected. But my friends, I asked them afterwards, after I told them what happened, and they said, we just thought you were without makeup that day.
Are you serious? Because it just looked fresh.
Very fresh, and I also had a peel, so my skin was very luminous. And they just thought I had washed my face and didn't wear makeup that day.
And you could have purchased like a whole new outfit because you didn't have to buy a facelift. It's a big dramatic difference between the prices between this sort of waking up and looking like you're well rested, and that and a facelift. What's the price of a facelift?
Well, a facelift is anywhere from $15,000 to $25,000 that lasts 10 years, where this kind of liquid lift is like $2,500 to $3,000, and that lasts about a year to 2 years.
And so what you can do too is, if you're scared about it, I mean, a facelift is permanent. When you do it, it's there. And what's nice about this is that if you didn't like the results, you know, sometimes 6, 8, 12, depending on how much you put in, it's over. Which it rarely happens that you don't like it.
Actually, frequently people will just kind of modify it a little bit. Say, just for example, lips. They may come in and we'll try out a certain shape, and then they'll come back in later with a more refined idea of what they want. So we can kind of shape it as we go and try to achieve exactly what you're trying to get.
So when someone comes in and says, I have this and I have this, is there a point where you say, actually, this is not going to help you? Who does it not help?
Well, we actually do frequently refer people to plastic surgeons for a full, formal facelift.
You have extra skin and loss of elasticity.
Yeah. Right.
You know, this is good if somebody just needs a little volume and need to relax the muscles that are causing wrinkles to form.
Age-wise, are you seeing it, you know, 30 to 50 or 30 to 60?
Close to 30 to 50.
It's a tough question because everyone's skin ages differently. You've seen people that look very young even though they're 60, and you've seen people that don't look so young even though they may be 40.
Oh, I know. They say I'm 39,
it's
which
genetic.
is fabulous.
It's genetic and it has to do with the collagen and sun resistance, but I'd say average age somewhere around 40, 45.
Somewhere around 40, 45. And you have 50 woman right here, Beth.
Thank
you so much for being
Thank
here.
you so much.
The both of Leconey, right there on the bottom of your screen, it is antiageinstitute.com, and you can call them at 713-807-1000. Looking fabulous. What a great show. Everybody looks fabulous today. We got the anti-aging makeup, the anti-aging food, and now the anti-aging liquid lift. How about that?